Everybody speaks about migraine diaries, but what should I actually track? We all get the recommendation to keep a migraine diary, but if you track your pain, your symptoms, your exercise, your diet, basically all those factors in your life would be like an Excel sheet, and it's not. So the question is, what are the essential factors that we should keep track of? And this depends a lot on the goal you have with your migraine diary. If the goal of your migraine diary is to get the right diagnosis for one of the different migraine types, and there are many, check out our other video to see how many, then there are 4 essential factors that help to differentiate between different migraine types. Those are pain frequency, pain intensity, your symptoms, and the duration of migraine attacks. This would be the basic factors that help a doctor making a diagnosis. Of course, you can track more, and more information is good to some extent, but also in the few minutes your doctor has in a consultation, it will be hard for them to go through a page-long diary. If you keep a migraine diary to help with your medical treatment, of course you have to keep track of your migraine attack. So there would be symptoms, frequency, duration, and intensity. But for this one, it's also important to keep track of all the management strategies you use. And one of them, of course, is medication. So how much medication do you take? At which time? And what is the effect of this medication? Did it help or did it not? Also, any other management strategies. It could be water intake, going for a walk, doing some meditation, yoga, going to a physiotherapist. Whatever you're trying and how it helps is important to understand if the treatment has to be adjusted. If you want to understand your migraine in the context of your lifestyle, additional to the factors we named before, there are some important elements you can track. One of them is sleep duration. There are specific sleep trackers, either phone apps or also smartwatches that can help you also to look at the different sleep cycles. Then also you can look at diet and water intake or liquid intake and activities you have. Activities could be exercise, but also different events that happen during your day, during your week. But as we discuss in most of our videos, migraine is not just physical. So we cannot only track elements that help us to understand our migraine from a physical perspective, so from the perspective of pain. We also, if you want to keep a comprehensive diary, want to look at emotions and thoughts. How do you do this? Ideally in a journal, in a mood tracker that can help you to review how your mood, how your emotions change over time and how this relates to your pain. Why are we doing this? Because the more we understand about our emotions and thoughts and how they relate to our pain intensity or frequency, the more we become aware of them in the acute situation. And only if we become aware of them, we can target them and respond to them in a more helpful way. Another main factor why people keep a migraine diary is to identify triggers. But the reason why I didn't name it as one of the goals you might have with your migraine diary is because research has 2 different sides on that. The first one says that yes, it's the most important thing you can do is understand your triggers, respond to them, or try to prevent them. But on the other side, there's leading research that says you have to face your triggers, which of course only applies to some of them. But we look into that whole new world and the whole different world of triggers in another video.